You mentioned already a couple of things, but what would you say are the most important things that you learned on TSW in Thailand and from this trip?
So something that I didn't know that I learnt, and it's so obvious to me now, is that, of course, for females, your menstruation cycle affects your skin, and your skin can misbehave. It's just like, it seems so obvious, but I didn't even think about it. So I learnt that while I was there. Other things that I learnt a lot about was irritant exposure, and we'll talk about that in a minute, and that's very important. I learnt a lot about the fact that Elidel and Protopic, the immunosuppressants, they actually behave more like stronger steroids in the way that the symptoms manifest, I guess, because there's stages of TSW. So when we're talking about stages of TSW, we've spoken about this before, the inflammation, oozing and scabbing, which is often for people that have class 3 and above. That's correct, right? Class 3 and above. They've used those. Then there's the flaking and the proliferation stage. And I actually got asked today on a DM, you know, I've going through TSW, should I exfoliate the flakes off? And the answer from me was no, because that is a sign that your skin is healing. So flaking occurs when the proliferation rate is slightly different in one area of your skin than the other area, but it is your body's natural healing process, and it does it to protect itself. So, you know, you should never disrupt the flaking, like exfoliate or anything. You should be gentle. I learned a lot about how to try and diagnose fungal and bacterial infections on the skin. So I think we've spoken about this before. A lot of anxiety around TSW happens because people don't know that they've got a fungal or bacterial infection, and their symptoms appear to be worse, and then they'll go to receive medical treatment, and you know, because these things, well, fungal infections specifically, appear very differently on a topical steroid withdrawal patient than for me, for example. So, you know, a fungal infection looks like ringworm, a ring. But for people going through a TSW, it doesn't necessarily always look so different from their surrounding skin, of course. So I learned a lot about that. And I also learned a lot about thickened, hardened skin and how you can treat that with a CAP machine. And unfortunately, how some people will have to live with a percentage of hardened skin on their body, like indefinitely, even though they go and get CAP treatment, which for me was very confronting.
Yes, this is very confronting. I find it as well, and I think this part also of the chronic hardened skin and the chronic elephant skin is quite new to the community. So we're trying to talk about it and bringing it out there so people are warned, and hopefully in the future we have no more cases of chronic type of hardened skin or elephant skin, because what it does to the skin is quite severe and can indeed be chronic for life.
Yeah,